Thursday, and good morning. Happy you're all here this morning. I know people are still signing on, but we're going to go ahead and get you started. Moving forward so that we can get through the agenda. Hope everyone is doing okay. I know there's a lot going on in all of our worlds right now. So, we thank you again for taking time out of your very busy morning to spend time with us to get some of the updates that we have for you today. So I'm going to go ahead and launch into what it is that I have for you, and then it will be turning it over to other team members so that they can walk you through the updates from their specific divisions. So Tom, go ahead to the next slide, please. And so we're asking that everyone go ahead and put your name and your organization into the chat. That's one of the ways that we're tracking attendance in all of our meetings. So I see a lot of people have done that, and I'd ask everybody else who has not to take a moment and go ahead and do that for us, please. Thank you. Go ahead to the next slide, please. So I've just got a few updates for you. One thing and another reminder, and we've said it before, and we're going to continue to say it in every one of our meetings, reminding everyone that we do have full enrollment mandates for all of our funding sources, and we'll be working with you. Our teams are going to be monitoring. They'll be communicating concerns beginning October 15th. I know I've seen a lot of enrollment going into the system. I've been kind of watching it and trying to keep up with where we are across all of our funding streams. I know that there were a few hiccups at the beginning, and hopefully everything's been ironed out and people are able to go in and get your children enrolled in the center. If you're still needing assistance, the team is available to walk you through to work out any issues that we're having. But again, we are having and we are under a full enrollment mandate. And we know that in January of 2022, for example, Head Start will begin to look at all grantees and looking at enrollment and discerning whether or not individual grantees will need to go on to enrollment mandates. And I'm hoping that we won't need to do that. We were on one prior to COVID. They decided to give everyone a reprieve because of COVID, but we're back now to full enrollment mandates. One of the things that they're looking at, again, is fully operational, meaning that we have children in seats in classrooms, that we've opened up our doors, we've welcomed our families back, and we're serving children face-to-face. And that is what's required both in Head Start and our state-funded PFAPI programs. And so hoping that everybody is minding that and making sure that as a delegate, if you've got sites under you, that your sites are operational, the children are being served face-to-face. We know that we're still in COVID. And so we are not ignoring that when we talk about full enrollment, nor ignoring that when we talk about full mandates. We do understand that if there's a positive case that you will need to do what's necessary and following CDPH and all of your licensing reps guidelines on closing a classroom due to that. So we know those kinds of things will be happening, but we are still saying that we need children in classrooms, in buildings, and in seats. We recognize that, again, we're still there and some of that may happen. And please continue to inform us and to see information about any positive cases because we are still tracking and keeping up with that information. And so vaccine mandates, I hope most of you, if you have not seen, President Biden did give an executive order, and what he said from DC is that he wanted anyone who has an organization or a business, 100 employees or more, that they have a vaccine mandate. City of Chicago, for example, we know as employees here that we are required to get vaccines. We also know that many of you have some of those policies in your organizations. I do want you to know, and anyone who has $1 of Head Start, to understand that Head Start, Early Head Start was included in that mandate. We're working with the regional office and also the office in DC to get guidance around that. I also know that Dr. Arwadi is working here in the city of Chicago based on the president's mandate to make sure that there's language around vaccines in the city of Chicago as well. If you don't have those kinds of things in your policies and your procedures, you will need to keep abreast of what's going on and continuing to get information and updates so that you can do what's required within your organization. Because what we don't want to do is have a vaccine mandate or the lack thereof, or the lack of vaccines in organizations be something that stands in the way of your continuing your federal funding. So just stay abreast of it. Again, know that this is something that's coming directly from our president. It is coming through the Office of Head Start and through HHS, and we'll be working with you as we get more around policies and guidance. We'll be sharing that as we get it. But continue to listen to what you're hearing from Dr. Arwady regarding this for the city of Chicago as well. And again, it's as always, if you have questions, you can always shoot those questions to me and I'll try to get answers for you. One of the other things that I wanted to just remind, it's an update, but a reminder, that we do want you to start to be vouchering monthly. One of the things that we know as we get towards the end of a fiscal year and you have not vouchered for all of your dollars and decisions are having to be made on whether or not we're going to be leaving dollars on the table. We really don't want to do that on any of our funds, Head Start, federal dollars, or PFAPI state dollars. We want you to be utilizing the dollars. Those dollars are for you to operate your business and your programs, pay salaries, ... And so what we don't want to do is leave dollars on the table. And so what we're asking and requiring is that you're doing monthly vouchering. That will allow us to keep up with what your expenditure rates are. It'll allow the team to work with you if you're needing to do budget revisions ahead of time, so that you can then put those dollars in places where you know you're going to be able to expend them. But what we don't want to do is get to the end of another fiscal year having dollars that were unaccounted for, unallocated, and then people are at some levels under-resourced. These are your dollars, people. We want to make sure that you're using them and actually gaining access to them. We know sometimes, the date of a contract can slow you down on getting everything in. But when we get to the end of a contract year and we're leaving, millions of dollars on the table, when we're serving children and families, we definitely shouldn't be doing that. And so, again, we're going to be doing a lot more monitoring, a lot more watching, a lot more talking, and making sure that we're keeping up with your vouchering and your expenditures so that we have quarterly responses. I know Tiffany, for example, when we're with our meeting that we do every week on a Tuesday, which is what we call a steer co meeting with us and CPS and the mayor's office, there's a requirement that we talk about expenditures and what's going on with our dollars out of the door. And so people want to know what's going on. Why are you not accessing? Why are you not able to use your dollars? Your vouchering monthly will give us at least a window of opportunity to have those kinds of discussions with you. And we hope to be able to make sure that all dollars that are allocated actually end up being used. And that's the goal of this program year. And so again, if there's questions about that, don't hesitate. You can shoot those questions to us and we'll be responding to you as needed. The last update that I want to offer you is, again, FA2 review. We did get notification. We haven't gotten the 45-day notification, but we do know that FA2 reviews can start as early as January 2022. We're going to start our prep work as soon as we can get these grant applications in and submitted. We're going to move from that directly to prepping for FA2 because, again, we know that they're coming. We don't know a date yet, but we know that the last time we did do an FA2, it was a heavy lift. And so we want to begin our process of working with all of you and making sure that we've done everything that we could. If you can remember the FA2 before, we were coming out, looking at classrooms, making sure you had all the equipment that you needed. And we were also looking at playground structures and making sure that we understood what was going on with those as well. So we're going to go back to that again, making sure that we're updated and knowing exactly what's going on. So when the federal reviewers have their feet in your doors, and they will, that they will be seeing classrooms operational, they'll be able to see children being served, they'll see them in quality sites, they'll be able to understand the qualifications of teachers because they will be doing interviews with teachers. They'll be looking to make sure that they understand your safety patterns. We may still be in COVID at that point. And so they should be able to see how we're enrolling children. If there's a new family coming in, they should be able to see how you're maintaining safety precautions and habits in your facilities. And they should also be able to see how children are transitioning through your buildings. They should be able to see how your children are able to play on your playgrounds and that your structures are safe. We're going to be talking about all of those things again, as we did before, working with you to make sure that we answer your questions, working with you to see what your needs are, to make sure that we're ready for the review that we know will be coming early next year. More to come on that. Again, once we can get all of our grant applications in, we're going to move from that directly to federal review. We know that you're already doing the work. And if I believe in reviews, if you're already ready, which I believe we're ready for a review any day, what we're going to be doing is just making sure that all of our I's are dotted and our T's are crossed, and that you and your staff feel comfortable with the federal reviewers that will be coming, who will be visiting you at your sites. So again, more to come. We'll talk a lot more about that as we get past the mid of October. So again, these are my reminders and updates for you today. But these are things that we're going to be following up on, and much more information that we'll be looking and monitoring and talking about, especially about enrollment and especially about your expenditures and your vouchering. So again, I'm going to turn it over. Just right now, I'm going to be here if there's questions for me, but I'm going to go ahead and turn it over to my staff so that they can go ahead and give you their updates from their divisions. I do have one other slide that I did put up. I'm going to let you go ahead and put that one up to the next slide, Tom. And that was just to remind everyone that we are actively looking at and minding your enrollment. Again, we know how many slots we're enrolled for. This particular document spells out across each of our funding streams what we're funded for, meaning the number of slots. And what I'm doing every day is I'm looking to see if the numbers are moving. So I want to say thank you to all of you because I've been able to go in and see that children are enrolled, children are getting into programs. And I also know that we're doing a lot of transitioning at the same time. So I recognize and want to acknowledge that I know a lot is going on the ground, but I want to thank you for what it is that you're doing and moving these numbers forward and getting us where we need to be, again, with full enrollment. If you're struggling with anything, if there's anything that you need to communicate with us about your enrollment, please do so as we're moving forward, because again, both of our funding streams are anticipating and looking for full enrollment. So this is a reminder of where we are. You'll be seeing these consistently as we meet with you and talk to you. And what you also will be getting is from us when we're looking at directly at a delegate. We'll also be looking at your enrollment patterns across your delegate and your sites and talking a little bit more to you about what's going on and what we see in your enrollment patterns as well. This is a year of enrollment. This is a year of getting children back in programs, parents back to work, children in seats. And so we're going to be working with you. But I just wanted to put this slide up as a reminder to you before turning it over to my team. So with that, I'm going to stop talking. I'm going to turn it over and let the staff go ahead and walk you through your enrollments. Thanks, Tom. You can go ahead to the next slide.
All right, thank you, Sarabel. I'm going to ask Tasha to go ahead and speak to the self-assessment. She's going to provide a self-assessment update. She's going to bounce it back to me, and then I'm going to bounce it to Craig to talk about our data update. Tasha.
Thank you, Tiffany. Good morning, everyone. My name is Tasha Smith, and I'm with the Department of Family and Support Services Program Administration Team. And I'll be providing some updates on the DFSS self-assessment. DFSS concluded its 2020-2021 self-assessment process, which included an assessment of all programs, regardless of funding stream. And thank you to all the self-assessment committee members, including staff from agencies who participated on the committee. Your participation and feedback was very, very valuable to facilitate some rich discussions throughout the process. And as a result of the self-assessment process, the committee identified 4 areas of focus for the upcoming program year. And they are ongoing monitoring, human resources, data, record keeping and reporting. And the 4th area of focus is a continuing goal from the previous self-assessment and will continue to be tracked this program year. And that area of focus is to ensure implementation plans are developed and executed that are related to the 5-year goals and objectives. And as DFSS begins to schedule and plan for the upcoming self-assessment committees and the self-assessment process, information will be released via the CSD update for those interested in participating on the DFSS self-assessment committee. That concludes my report, and I'll turn it over to Tiffany.
Thank you, Tasha. So I wanted to talk about the grant applications, and that's going to be covering items 2, 3, and 4. The first one that I wanted to talk about is the Head Start, Early Head Start Baseline Grant Application. You have not received those in your inboxes yet. Just wanted to let you know I've received individual emails asking, Tiffany, did I miss that email? You have not missed the email. We have not sent it out. There's a couple of things that I do want to go ahead and indicate about the Head Start and Early Head Start 1. One is that it's a baseline application. It's not a continuation like our other two are. And so with that, the baseline application is, there's an opportunity here for us to go ahead and make sure that we're reporting out on the outcomes of our previous grant award. So when we're talking about those program narratives, we really need to make sure that we're going to be able to speak to them from a data standpoint, right? That we're able to go ahead and pull together those things in which we've accomplished during that last grant year, to be able to tell the story about the funds that were utilized previously and how we're going to be moving forward. The other key thing that I wanted to make sure that people understood too about this baseline application is the different service areas. Typically, the city of Chicago has been able to have a footprint across all of our 77 community areas. And traditionally, we held programs in at least 60 plus community areas. This year, with the designation renewal for the Head Start, Early Head Start Awards, we were awarded slots in 39 communities, and we're sharing spaces, some spaces with other grantees. I want to make sure that when you're, putting together your application, really speaking to your service area and your recruitment area to be defined by the community in which you have been approved to serve. That's important, right? And, just making sure that you're aware that it's not, all the communities that you can fit on there. It really is going to be the communities that you have been approved to serve. And I want to make sure that is clear. But we will be getting the Head Start, Early Head Start baseline grant applications out to you. And we will adjust the time frame for completion as a result of this delay. What we have sent out so far is our Early Head Start Child Care Partnership Continuation Grant application. And we've also sent out the Early Head Start Expansion Continuation Grant application. I'm happy that all three do align with December 1, 2021 to November 30th. The difference between CCP and expansion is that they are a continuation grant. And so the goals have already been established. The objectives have already been established. And what I'm asking each agency to do as you're reporting on those goals is really progress updates. So for year one, you should be able to give progress updates. Year two, you should be able to give progress updates as we're in year two and we're nearing the end of year two. Year two ends November 30th, but the progress that has been made during year two should also be included in that grant application under the goals section. We really need to hear from you and also look ahead, right? The goals and objectives have already been laid out for even year three so that you can understand where we're going. The end result of our goals, if you read them thoroughly, you'll see that we have goals for 2024 as we're heading there. And we want to know, where you are in achieving those goals. So the grant application for CCP and expansion, I am gonna, be asking that the September 20th date is the date that you stick by to go ahead and get us that budget and budget narrative along with the program narrative and those attachments that go along with it. The approvals, however, are due September the 27th. So 1 week later, we're expecting for governing bodies to have been presented with the information and approvals to happen. If there are any extensions or things like that, you really do need to put it in writing to ask for an extension. We're very tight on time. And so we're not going to be able to go ahead and have a lot of wiggle room in this space. I wanted to make sure that I'm saying that for everyone. I understand when you ask, you want to receive. In some cases, I may be able to say yes. In some cases, I may have to go ahead and say no, and let's negotiate something that's going to be a lot sooner than that. But we are, having to make sure that once we get your information, that we have adequate time to review the documentation and of course, get it to our funders. So this is quite the process. So with that being said, continue doing the good work that you do for the FY22 fiscal year from December to November. And if you have any questions, don't hesitate to go ahead and ask. We're here to go ahead and support you along the way with the completing of those grant applications. The next item that I wanted to mention was the contracts that we put out there for various agencies. I know that we've sent a lot of awards out, and I get emails saying, Tiffany, but what is this one for? Those are good questions. If you've received an award and you're unsure as to what they're for, please, go ahead and reach out to me and let me know. Some of the ones that have already been sent out, I just want to kind of review them. I know I've talked about them before, but since they're in play at this point, I want to make sure that they're in your inbox, right, and that you're working on them to get them to project completion. So our Head Start, Early Head Start, the 4-month prorated awards, they're already out there. A lot of you have already submitted those and gotten them back to us. There has been a delay on processing, just so you know, on our controller's end. So I do apologize if there has been some delays in kind of getting you that approval that you're waiting for. But those are in play, Head Start, Early Head Start for the 4 months, August 1 to November the 30th. So that grant application that you're completing, that you will complete for FY22, right? That's going to be picking up, that's the baseline from December 1 to November 30th, which is going to then run into a continuation application after this very first year. Head Start and Early Head Start for our unfunded and underfunded, we wind up securing money through our funder, HHS, to award the months of August and September. So those contracts went out, and those contracts either have been completed by now or they're in the process of being approved. And I mentioned already that there were some delays on our controllers' end, as they do have the final approval when it comes to those budgets. So the last set of contracts that went out recently was the ones from our mayor's office for the unfunded and underfunded. Those are the 3-month awards. So let me just kind of go back. The 2 months for August and September, those are for transition services from our funder. And so HHS, in helping us to go ahead and kind of think through as we had the DRS application and understanding that programs still needed more time to go ahead and transition children and families. The mayor's office funding for the underfunded and unfunded, that's a 3-month award, October, November, and December. And that money is to really help you operationalize and be able to kind of see it through with your transition. We understand everything may not necessarily happen within the 2 months that were awarded by HHS. And so this is to give you that additional flexibility with helping your sites that were unfunded or underfunded. And so if you have any specific questions about that, let me know. But those who were awarded should have received those award letters already and should be working on them. I'm going to go ahead and ask Craig to go ahead and give an update on Coppa. But before I do, so Rachel already mentioned it, full enrollment. That's what we're expecting. And when I'm looking at Coppa on a regular basis, on a daily basis, and I'm not seeing what I need to see in terms of numbers, I will be reaching out to you. I really need to understand what is the plan in order to get there. And so Rachel had showed the numbers on where we were with enrollment, and nobody's at 100% in either category. That's a concern. I am happy to say that all of our classrooms needed for Head Start have been set up. But on the other side of it, on Early Head Start, I am concerned. There are some home visiting clusters that need to be established in order to go ahead and ensure that you're able to count children in Coppa. There are some classrooms that need to be added to Coppa in order for you to fully reach your potential with Early Head Start slots. And so I'm going to be having real conversations with real people when it comes to these particular slots and making sure that we can get there. I've already sent emails out. If you've heard from me, then you know who you are, but we really do need to make sure that we're making good on what these numbers represent. If not, we will have to look at the alternative. And so the alternative can be discussed individually, but full enrollment is where it's at. Before I turn it over to Craig, I just wanted to mention slot allocation. Our Coppa system is the record of truth for us. And so if you're looking in Coppa and all of your slots are not there, or if you have questions, there's any type of discrepancies, I definitely need you to let me know, because, I need for Coppa to be able to be the record of truth for us when it comes to enrollment. And so if something is off, if there's something that needs to be corrected, you need access, any of those things, let me know. In terms of reallocation, I have received several applications asking for reallocation. I will be looking at those. I am asking for your patience and me being able to get back to you just to go ahead and get your response, but you will receive a response because I want to make sure that we're making good and helping you get there when it comes to full enrollment. Craig's going to go ahead and provide a Macopa update really quickly, and that's it. Thank you, guys. Craig.
Hi, everybody. I don't want to take up too much of your time, and I feel like Tiffany just covered most of the bases. But again, we do need to see that all of our federally funded seats are filled this month. HHS is checking on our status monthly. We did get a breather due to the COVID disaster because everyone's status was reset, but that ends with this year, and we do not want to be back on an under enrollment watch status again. So a couple of things that I'm not sure everyone is aware of: when we report these things, we report them at the site level, and we need to report the slots and have them in the federal system at the classroom level. So if you have received new funding, your funding structure has changed, please make sure that the funding sources of the classrooms in Coppa are updated and all of them are there. So I know which classrooms to include under which grant when we make the report. And we need these in Coppa yesterday, basically. The exception is if you're trying to open or add a new building, we do need to make sure that the facility is safe and legit. We do have a review coming up and so on. So a new building, even if it has the same name as an old one, is a new site to us because it has a new license number, and we cannot put federal slots, state slots at an unlicensed facility. So we do need to make sure that you have all that information. So if that's what you're trying to do, please keep us up to date on that and send us with the status of their attempt to get a license and the number and expiration date, all of that. We need that to activate the new building in Coppa. But other than that, either funding the classrooms and adding them is up to you. We need them in there now because you don't, according to the feds, you don't have slots if you don't have a classroom to put them in, because that's how they are added. So if you want to keep the slots that you have been allocated, make sure that they have a classroom in Coppa that we can look and see. There they are at 8 early Head Start slots in the Busy Bees, or however it is. The second thing, we've seen a lot of restructuring in Coppa over the last couple months, obviously. And this has been taking a lot of time. We're also down a man in terms of manning the help desk right now. So we understand there is a delay in processing tickets. We're trying to get through all of them in the next 2 weeks so that we can report everyone who's present as enrolled in September. Again, you can help with this and speed it up by making sure your classrooms are in place, that they have teachers, and that any other kinds of issues in terms of the structuring that you can control are taken care of, so we don't have to worry about those pieces. And be aware when we're talking about full enrollment, we report enrollment every month on the 7th of the next month. So we will report enrollment for September on October 7th. Yes, that's true, even if it's a weekend. So that means that anybody who needs to be in the system has to be in there by that point. If you enroll someone on October 8th with a September 15th start date, you may believe that you enrolled them in September, but you did not, because we already reported it and they were not in there. And that's pretty much final. I have had to restate an updated enrollment report with the feds before. It is not easy. It takes a lot of work, and I'm not going to do it over year one kid. So please try to get everything that we need to get in there in place this month so that we can make a good and happy report on October 7th. One last thing about slots being reallocated and moving around. There are some sites that were set up as part of a larger organization in Coppa because you were partners of a federally funded delegate. And in many cases, that funding situation has changed, and you're going to need to be set up as an independent site, no longer associated with the source of former Head Start or early Head Start funding. If that's true with you, we'll be getting in touch with you over the next few days. We have set up new sites for everybody, but you don't necessarily know it because we're going to try to move users, staff records, child and family records all at the same time so that you can have continuity of operations. So not everybody will be on the same day because there are only 2 of us in the data unit. So we'll be probably doing 1 or 2 agencies a day. So if you hear from us that that's going on, just be aware, we'll do that. You won't necessarily notice the difference because we'll change what site you have access to. However, some people, if you lost one source of funding, but you're still funded through another one, for example, if you're still a partner of another agency on the Early Head Start Chapter Partnership Grant, you will need to stay where you are because that way that funding is structured in Coppa mirrors the way that's set up on the federal site, and we need to be able to keep the site together and the classes together in one place so they can be effectively monitored. So there are some people will be moving and some people will be staying where they are, and we will be in touch with you over the next few days to finalize that. I know there's going to be a lot of questions. You can email me after the meeting. Okay.
Thanks, Craig. I appreciate it. There was a couple of questions that came in the chat, and I just want to cover them for everybody because I think this is the kind of everybody needs to know answer. But the question was, can new organizations apply for the FY Head Start, Early Head Start baseline grant application? And so only the organizations that were approved in our designation renewal application can apply. So there's 14 organizations that we have that are receiving Head Start funding through the city of Chicago. And there's 13 of the 14, 13 of them are also receiving Early Head Start funding as well. So there's only 14 agencies that are eligible to complete the baseline application. And those who, they know who they are, but pretty much if you're not one of the 14, you can't apply for the FY22 baseline application. The other question is, am I correct that the baseline grant is for new agencies? No, the baseline grant is going to be for anybody who is awarded Head Start or Early Head Start. Baseline just pretty much means the first year. So you establish your baseline, and then from there, then we have a continuation application every year. So as I mentioned, CCP and expansion are in the continuation year. But this baseline application is going to set the foundation for how we move forward over the next 5 years. So you're going to see new goals. And so we're going to be getting you that application out really soon. But if you're a part of the 14, you will be completing that baseline application for Head Start, Early Head Start. And I think I've covered all the questions that I saw in the chat. Someone just sent direct message to me. So, all right, next slide. I'm going to go ahead and pass it to program operations. B. Nichols.
Thank you. Good morning, everyone. We have an update on the developmental screening tools. And as you remember, we did survey all of the agencies to determine what your needs were. And so we're happy to say that those tools have been ordered and they are en route. Janice Taylor and the Education SSCT will be scheduling a pickup directly with agencies in the next few weeks. So that pickup will be at the King Center. So look for more information. Thank you for your emails and reminders. And so with that, I am going to turn it over to Elaine.
Good morning, everyone. I want to say thank you to our delegate agencies who have been underfunded, and to our new delegate agencies. I just want to say thank you for the timely submissions of your child transition trackers as we try to as we work together to make sure that the children who are impacted by the grant decision from HHS to make sure that they have placement. So we are still expecting our agencies to submit those child transition trackers through the end of this month. And I also want to say that those of you who have children, families who have decided to stay at your agency, although there is no Head Start or early Head Start funding there, please make sure that you get your parent choice letters into us so that we can continue to report that to HHS. And again, thank you for your patience and your due diligence in getting that information to us. Thank you.
Thanks, Elaine. And now we're going to turn it over to Seth.
Good morning, everyone. Hi, just a brief inventory update. So we are in the final phase of making our inventory visits. We just want to thank all of you for collaborating with us to put eyes on the inventory as we work towards completing the disposition of items at your sites. We are out right now currently working on what we call Category 4, which is all of the agencies who are continuing to work with us for early Head Start and Head Start. And just if you have any questions about the process, you can feel free to reach out to me. I will put my email in the chat. In addition, the 45-day webinar and Q&A. So if you noticed in the CSD update, we posted a recording, which I'll put in the chat, of our 45-day requirement video. I just looked at it right now because I was going to copy it to put in the chat, and I saw there's 97 views. So that's good. It seems like a bunch of people are looking at it, and we appreciate that. Since it was a recorded webinar, usually what we like to do is do a question and answer session. So since it was previously recorded and placed in the chat, we set up a Q&A session for Thursday, September 23rd from 10 a.m. to 11 a.m. I'm going to post that information in the chat right now as soon as I get finished talking. And then also the PowerPoint from the webinar is also in the chat, so everyone can download that. It's also in the CSD update so that you can refer to it. And there are some links embedded with some information regarding, like toothbrushing, family style meals, and some other requirement information that will be good for you to know. With that, I'm going to put that in the chat, and I'm going to pass it back to you, B.
All right, thank you, Seth. Just one last clarification. In the last CSD update, you may have noticed that we had Globetrotters listed there as doing lead and water. That is incorrect. Globetrotters will be coming out to do facility assessments, and they will be doing those assessments on Head Start and early Head Start programs. If you remember back earlier in this year, 21, they already conducted visits with early Head Start CCP. So there'll be more to come with that. I think along with that, we also posted attached a downloaded letter that gives them authorization to come in. It's signed by our deputy. So please alert your sites because our timeline is very quick and we want to be able to get in and get out. So please keep the scheduled dates that are set up with Globetrotters. In terms of lead and water, though, we will be sending out in the next CSD update a resource called Lead Care Illinois. And what Lead Care is a new initiative that's been designed to provide free training and water testing. So we really want to connect you with Lead Care Illinois. And with that, I am going to turn it over I believe, to Coppa. Will?
Good morning. Yes, thank you, B. Appreciate that. Good morning to our team. Good morning to our external delegates. My updates as it relates today, a very few of them. I wanted to speak to our ECBG, PFA, and PI reporting requirements as it relates to our CPS and again ISB. Our funders as it relates to again those PFA and PI programs that operates within our CBO sites. Recently, in our past two CSD updates, we've issued the newest program requirement as it relates to PI teachers having that IEIN number entered into our Coppa data system for reporting back to CPS and then ultimately to ISB. What I have here on your screen is a snippet directly from our ISB website as it relates to the IEIN number. Previously, it was only required for our PFA teachers. Those numbers were required in addition to those Pell licenses with those said endorsements for those programs. New this year, ISB is asking to be able to track all teachers in either the PFA and PI programs with that IEIN number. Tamela, our supervisor over program development and quality unit, have just entered that into the chat. Please save that, please tap that link so that you can have that in your computer so that you can be able to find this document as we are working on to disseminate that information across all of our delegates as it relates to these programs. So again, this year it is new that all of our PI teachers must have that IEIN. And again, here's the information for you to instruct your teachers of those PI classrooms to go into the educator's license information system through ISB, the ISB website. And there's the link there as well. So they can just sign in, it's simple, sign in, put in the basic information, and then that system will automatically generate the IEIN number. We then need that IEIN number to go into the Coppa database under the HR tab for our PI teachers. Thank you. Tom, next slide, please. In lieu of talking about the new updates, we also would like to offer the invitation to have our CBO, our partners, join us for PFA and PI informational sessions coming up next week on September 22nd. We will be doing PFA and PI center-based programming from 10 a.m. to 11:30. And then we'll be doing our PI and prenatal home visiting and home-based programs from 1:30 to 3:00 p.m. These informational sessions can be registered. You can register for these sessions on our Coppa system. They are posted as of this morning. I urge you all to please go in that way and register for these trainings so we can all see you there on the 22nd. Again, for our center-based programs, PFA and PI will be that morning, 10 a.m. to 11:30. And then our PI and prenatal home visiting and home-based sessions for PFA and PI will be the afternoon sessions, 1:30 p.m. to 3:00 p.m. Thank you, Tamela, for answering that question. I see it in the chat. That actually wraps my updates as it relates to our programming updates. I must also, it's not on the chat, but what I have everyone here today, I would like to remind you all to please go and check your emails. We've had some communications happen over the past few days as it relates to us compiling this information to begin our first reporting, which is due to ISB on October 1st. We are looking at Coppa as we're gathering this information. There are some missing fields. You should have received some communication from our teams about those missing fields. So we appreciate your due diligence in correcting that information, entering that information in Coppa. And for those of you who have reached out to seek support, we thank you for that. And please continue to do that if you do ever need any more support in getting that information entered into Coppa for our reporting purposes. Thank you all. I'll pass it right back to our deputy if she's still there. Or Tiffany.
Goes back to Tiffany. Thanks, Will.
Perfect, thank you. Tiffany, sorry.
You're muted, Tiffany.
Is someone from our finance division on?
Yes,
Nicole Roberts?
I'm here.
Oh,
Hi,
okay.
everyone. My name is Nicole Roberts, Supervisor of Accounting. I'm going to be giving the finance updates, starting with the current expenditure rates for our HHS grants. Right now, Head Start is at 70% expended. Early Head Start is 61%. Early Head Start CCP is 43%, and Early Head Start expansion is at 42%. So just reiterating what Sarita mentioned earlier, the importance of monthly vouchering and getting your expenditures in is very crucial. So please continue to do that. I do understand that, as Tiffany mentioned, we do have some delays in budget approvals, but we'll continue to work with you, and the accountants will notify you as soon as your budgets are approved. And you can also keep an eye on those within your orders tab in iSupplier. Moving on to final expenditure rates for the block grant, the gear funds, and the childcare. Next slide, please. And so the early childhood block grant ended June 30th. We were at 85% expended. For the gear funds, it was 79%, and childcare was at 29%. All right, next slide, please. All right, some of this will be also reiterating again what Tiffany and Sarita had previously mentioned. We recently submitted and were approved for the COLA funding for the new period of August 1st through November 30th. And you had previously received the awards for the initial awards as well as the COLA, and those budgets were due back already. So if you have not submitted those, please go ahead and submit those as soon as possible. So our program and finance divisions can review and get those submitted to the comptroller's office. For the closeout for Head Start, Early Head Start, those revisions for COLA and also the July and August through September extensions are currently in process. We thank you for your patience as we work through getting those all processed and approved. We are looking at a final voucher submission deadline of November 11th. Next slide, please. And then the bridge funds from the mayor's office, you recently received, those eligible received the award letters, should have received the award letters on the 14th. And today the finance accountant for Head Start, Early Head Start, Sharon Davis, did provide the budget form. It will be the same as the Head Start, Early Head Start budget form that we're currently using. And if you can submit those back by September 27th, along with any required contract documentation, the anticipated deadline for vouchers on those budgets will be January 28th, 2022. And iSupplier updates, there's been some communication from our OBM office as well as the department regarding changes to the certifications within iSupplier. They're moving from the actual paper forms to an electronic format. The target date was last Friday, the 10th on those. We received an update yesterday from OBM. They're now looking at a target implementation date of tomorrow, Friday, the 17th. Until you receive final notification from us that those changes were implemented, please continue to submit your paper certification forms. Next slide, please. For just to reiterate the importance of timely vouchering, we require at least at a minimum of monthly vouchering. And if you could submit as close to the 15th of the following month as possible. We understand that sometimes you may need extensions, that's fine. You don't have to request an extension to submit beyond the 15th. But as we get closer to the closeout of the grant, it is very important for you to get your vouchers in timely, because the comptroller's office does have final reporting deadlines that they have to meet. And again, the voucher deadlines for the current Head Start, Early Head Start grants ending July 31st and September 30th will be November 11th of 2021. And then for budgets, the CCP expansion budgets ending November 30th, the deadline will be January 11th, 2022. And then for the new bridge funding budgets that end December 31st, the voucher deadline will be January 28th, 2022. And then regarding the grant application, you've all received your CCP and expansion packets, and those submissions are due on September 20th. And then just be on the lookout for the Head Start and Early Head Start baseline grant application materials to be communicated soon. And if you have any questions regarding anything, if you're receiving deletion memos or rejections and need help in resolving those, please reach out to your finance contact. Reach out to the accountant specific to your grant or myself, and we will help you through those. Thank you.
Thank you, Nicole. Very good information. I do want to go ahead and just make a couple of comments about the information that Nicole was able to provide. I've received emails, she's received emails about the funding that went out on September the 14th, just asking, hey, what is this for, right? For the unfunded and underfunded. And so the funding source itself is the Coronavirus Relief Fund, that's the CRF. And so we did get the funding through the U.S. Department of Treasury. People need to know that if you're completing your CFA, that those are federal funds. In terms of how you can use those funds, this is really, again, an extension of understanding that there's transition activities that needed to occur, understanding that people still have programs and it may not be easy to pivot in certain situations. And so use your cost principles, rely on your cost principles in trying to determine what's allowable, what's not allowable. Even though this is not Head Start funding, we still don't want you to deviate from, the cost principles. And so make sure if you have any questions about spending that you let us know. But it's a wide range of things that can be covered under these CRF funds. But, primarily these funds was provided to go ahead and help bridge the gap, right? In the funding that was not provided for unfunded and underfunded sites that you have. So I hope that helps. Let me know if you have any questions. The other thing that I wanted to mention was about vouchering. In your contracts, there's a clause in there about monthly vouchering. So I want to make sure, as Nicole mentioned, that you're doing it at least monthly. I do want to also mention that we have some agencies who voucher every pay period. And so that may be twice a month, right? And it really is up to you on how, you can do more, but what we're saying is don't do less than 1 month, at least once a month is needed. But for agencies who wind up kind of increasing their cash flow and they voucher every time they have a payroll, that may help them out in terms of just kind of keeping that cash flowing through their organization. And so sometimes we get vouchers that are only for payroll, and then it may be followed up with the 1 month voucher for non-personnel items. It is up to you on how you want to go ahead and get that accomplished. What we're saying is, though, at least on a monthly basis, we need to see vouchers coming through. And so if there is any delays, even though Nicole mentioned that you don't have to get approval from us to go ahead and submit later than the 15th in programs, we do want to know if there's a delay. Communicate with me, just send me an email. Let me know if you're having difficulty in submitting your voucher. Most recently, we had to make some decisions in our program. This had to have been maybe maybe 3 months ago, when we did it based off according to how you voucher, right? So we wind up making decisions at DFSS based on what we saw in our financial management system. And so for some of you, that was a win-win, because it's like, okay, I was able to get additional dollars for the month of July, And for some of the agencies who did not submit regular vouchers, we weren't able to see that you were going to be able to fully utilize the grant. And so you didn't get that additional July voucher, and you really had to plead your case after the fact. So it is important for you to go ahead and make sure that you're keeping up with vouchering and that you're expending the grant. That's the only way we're able to know if you can fully utilize the funds or not. So please make sure that you're communicating with us in and around your expenditures. With that being said, we'll go to the next slide. And I'm going to go ahead and see if our Deputy Commissioner wants to close us out.
Thanks, Tiffany. As always, I know it's a lot of information that we're throwing at you, but we're trying to keep you up to date as we're being updated on different items. Just can't impress enough on all of you the need for you to voucher regularly. To the last part of Tiffany's conversation, when we were trying to make some decisions about budgets and literally trying to see what people's expenditure rate was in order to determine what the needs were in order to close out a year. When we get down to the wire and we have to do that again, we don't want to have any delegate who needs funds not be able to access the resources that you need because we've had to do something different with the funding. We want to work together through this. If anyone is having any difficulties with what you're being asked to do, we're asking you to raise your hand and let us know what that is so that we can be a little bit more planful with you. But again, we need to make sure that these dollars get out the door. We need to make sure that these dollars are in your hands so that you're able to provide quality services there on the ground. That's what these dollars are for. The state doesn't want dollars returned, and neither does the federal government. They want the dollars to be expended. And so we're hoping that this year we're going to be able to show that our expenditure rates are going to go up, that we're going to get our dollars out of the door, and then we're not going to be leaving dollars on the table. And that's our goal this year. And so if it feels like we're kind of on you, that we're constantly bugging you and we're constantly talking about it, that's our goal this year. We want to work with you and we want to end this year on a high note. And the high note for us is dollars expended, dollars in your hands, and dollars are being served the way they need to for children and families out there in community. Again, I remind everyone, we are still in a pandemic. And so I'm asking everyone to stay safe, everyone to do everything that you have been doing at your sites, keeping your systems in place. Let's not relax any of what it is that we're doing because we still are in a pandemic. Continue everything that you've been doing because what you're doing has really mitigated us from having continuous spread of COVID in our child care centers. And I can't thank you enough for that. On the other hand, I just want to say what we know by doing what we're doing, we're saving lives and we want to continue to be able to do that. And so we encourage you to continue to do everything that you're doing. When it comes to the vaccine mandate, which I mentioned earlier, there'll be more information coming. As I said, I know some of you have already put it in your policies and procedures. As organizations, you get to do that. But again, as we get more information on vaccine mandates, we will be definitely sharing that with you. Lastly, just want to remind everyone, we are face-to-face this program year, meaning that we've moved away from remote learning. We are serving our children in seats. Again, I recognize we're in COVID. If there is an incident of COVID-19 and you have to close a classroom, we understand that. But outside of that, classrooms should be open and operational and meeting the guidelines for the number of hours of service. And the reason I'm saying that is I want to make sure that everybody understands EHS-CCP requires a 10-hour day. And so if you're operating an early Head Start child care program, you are to be serving those families across a 10-hour day. And your staffing capacity needs to match with that, allowing for your teachers to be able to get the breaks that they need and everything else. And so we're going to continue to talk about all these things as we move forward. There's going to be a lot more training, a lot more information that we're going to be giving to you. But again, I thank you again for spending time with us today. As I said earlier, as soon as we can get all of our grants submitted, we're going to move forward and we're moving into getting us all the information that we need, our I's dotted and our T's crossed for our reviews that we know will come up. I only added one in that slide where I talked about the FA2, but I just want everybody to understand this is a new grant that we have, our new 5-year grant for CCP, our 5-year grant for Head Start, Early Head Start, and a continuation for our EHS expansion grant. What that means for us is 3 reviews. We will have an FA2, we will have an FA1, and there will be, and it is being planned for face-to-face class assessments for our Head Start classrooms. And so know that we're going to be working with you through all of that. We'll be guiding you through it. We'll make sure you have the tools that you need for all three of these to be successful. But just understand we're launching into the ability for the federal government, Head Start, to do exactly what it would have done in 2020, which is on the ground reviews. And so we're emerging on the other side where we're looking at the ability for them to come into our sites. And that's what's going to mean that we're going to have that FA2. That also means that we're going to have that class assessment. And so if there's any other questions that anyone has, we are always available. You've got our email addresses, you know how to reach us, you know how to call us. We know you know how to get to us when you need to. But if there's any questions or any concerns that come up, please do not hesitate. Continue to work with our teams, especially those that are working with them on child transitions, to make sure that we know where all of our children are. That's one of our obligations under the Head Start Act, is that we know where every child that was on our grant, where they are right now. And so they're going to be following up with you as we're closing out in all of our closeout activities. I know Seth and B talked about a little bit, child transition, inventory, and also the data transfer. The last thing I'm going to say, we're moving children from one site to another that requires a hard copy file to be moved. The team will be working to assist in making sure that those files are moved, meaning that our DFSS staff will be working and will be making sure that there's a clean handoff of any documents that are leaving a delegate site going to another delegate site. And we'll talk a little bit more about that in this transition phase. Again, everyone, I can't say it enough, everybody stay safe. Enjoy the rest of your day on Thursday. Have a great Friday. And please have a healthy and safe weekend. And we'll be talking to all of you soon. You know how to reach us. Reach out to us if you need us. Everyone, take care. Stay safe. Keep doing what you're doing, serving those babies out there. Can't wait to get out and see some of them face to face. So take care, everyone. Have a great day.